So here I would like to thankful to our South Indian professor, even Dr. Even our professor has been given lot of information, Dr. C.K. Raju. Apart from that, his name is Dr. Abdul Rahman. Fazlur Rahman. Dr. Fazlur Rahman has given the very good information. Really, all of us will give credit to him. Who has been around, people says acupuncture is 5,000 years ago has been originated, 8,000 years has been originated. But on that level, normally used to see there are the 12 pulses, and he has given the very fundamental formula to the mankind that see the 1 pulse or see the 6 pulses or 5 pulses to recognize the constitution about the disease. So therefore, we all are, so there are the doctor brothers too, but among them is the one is existing, Dr. Fazlur Rahman. Sincerely thankful and salute to him, and really has given lot of information to mankind. Since the 6,000 years has been not founded, but this existing person has given this information. Really we want to love to him and we want to pray to him, and God will give peace to him and healthy as well. So this information how to diagnose and treat by using the single needle as well. So even we know Professor C.K. Raju has given very good information among the 365 points. Even that collaterals, normally I said that there are the only 15 collaterals and the total points are 361 points, and normally says that is the whole year. There are the 365 days. Each and every day there is the acupuncture points is activating every day. So therefore the whole days there is a one acupuncture point is strongly and substantially will going to activate in our body to become the normal healthy state. So further these points about the pulse diagnosis, once we can understand the philosophy and depth of this, and certainly we come to know how to treat the patient by using the minimum needles. Normally we used to, even when I visited China, there is a neurological department, how there is a Manipal and Fortis hospital. So such a one whole hospital is one unit for the neurological center, migraine. What is this? I have seen all the centers for the migraine. What is this issue? Then the whole head has been around more than 100 needles on this scalp. Then there is no fun to treat in this way by using the 100 needles on the scalp for the migraine. What is the use of that? Even you can take for the small children. So once he will see that he started playing on the head to manipulate all the needles, patients get relief. There is no fun here. Right. So therefore the originated, even we know lot of history was there. So the acupuncture has been originated in South India, and some other people says it has originated from the North India, that has been migrated to the Sri Lanka. The Buddhist monk has taken over there, from there has been passed to the China. There has been recognized this acupuncture and has been done lot of research on this, and they are implementing this, and most prominently how the people immediately go to the here for the Western medicine. So those people immediately rush to the acupuncture to take the treatment. If the acupuncture and have some less results, further they will integrate that some Western medicine or the Chinese herbal medicine normally they prefer to take. Even moxibustion, when I visited this particular moment in the December, January, February, I was 3 months. So that was the very fog, and the fog is falling down. On that condition, they normally take that moxa leaves as a water, warm water, and put it the herbals, all the herbals as a cocktail, and they take as a water as a warm to improve the immune system. So otherwise even outside, all the inside there are the heaters. Heaters again it will be the synthetic, it's not the natural. So therefore the natural way how to boost our system they take as these herbals. You understood? So in this methodology, once you understand this depth of philosophy, and certainly you can use by using the minimum needles how to treat the patient, and by the pulse diagnosis we'll come to know on coming days. And further, there is another important diagnosis I would like to tell you is the emotional diagnosis. There are the two diagnoses. One is the exogenous diagnosis and endogenous diagnosis. Exogenous is coming the pathogens affecting from the external environment to the human system through the nose, mouth, and other urethra and other orifices or openings. So it will enter. This is the endogenous disease is the biggest disease today. Even most of the people are suffering for this disease. So those diseases are the emotional aspect. What are those emotionals? Present tense emotion, past tense emotion, future tense emotion. What are those emotions? Normally there are the 5 emotions. Present emotion. What is the present emotion? It's the anger, irritability. So immediately we'll get anger. So that reflecting as a present emotion, present tense, that is reflecting to one particular element, one particular organ. The person who are suffering for the headache or the people who get anger immediately, so that is related to which element? It is related to the wood element. That means the liver is affected. So you need to understand, once the patient will enter into your chamber, and you need to understand their philosophy. I told you the young diagnosis. Once he will enter by coming, even Reiki Grandmaster here. So once we will enter, so we can recognize what is the nature of this person. For example, in terms of elements. So you need to see any disease. We need not to bother about that. All the diseases comes under only the 5 natures. You understood? So this, what kind of the element has been affected with them. So by looking we can understand. Otherwise once he start telling to us, so what is their constitution? For example, emotional aspect. The person once will enter, he will start crying before telling their problems. That is the past tense. Crying is not a present tense. That was what happened. After crying, he will start telling their complaints or issues. So that is the past tense. That is since that issues has been originated because of grief. Grief is reflecting to the lungs. Right. At the same time, you can see the confusion status, or they are always thinking. What are those? Jealousy as well. That is reflecting to the earth element, spleen and pancreas, stomach. You understood? The person always in confusion status. So, sir, I cannot tell you, sir. I have lot of issues. I forgot, but I don't know what I want to tell you. So, I don't know what I would like to do in future. This kind of the confusions. So, what is the status of this? Future tense. Right, he is in not the stable condition, he is always in tense. So another emotion is ego. Once we'll come to the chamber, he'll talk very perfectly. So doctor have to think whether I am a practitioner or he is the practitioner. So he'll tell everything, and in fact he'll tell about the diseases, and some people will bring the printouts through the net. So these are the points for my disease. Doctor, this will be helpful for my condition. Please check it. Or you can apply these points. I don't know where the points are situated. So they talk in that level. That means they are in very perfect. That's not ego. So that is one kind of happiness. So at the same time, who have this kind of the status that is related to the fire. Right. So apart from that, another emotion is frightened or fear. So everybody have kind of fear. So that fear is related to one particular organ. That organ is kidney. Right, now all the 5 emotions, by looking beyond diagnosis, and apart from that is the inference diagnosis. This is also known as inference or emotional diagnosis. And further we want to diagnose is the key and pillar in acupuncture is the pulse diagnosis. Once we understand this principle, and certainly the implementation is very simple. For example, and we have diagnosed them how to use. And another, the people who have been completed their programs in terms of first year or maybe who has been in this field, and how to treat the patient. So once I will give you, sometimes you will get that knowledge and you can implement in your practice. Now there are only one organ has affected. For example, only he has the headache and his emotion having the irritability. Then how to treat that patient? So one thing we need to understand is there are the 361 points, and apart from that there is another is auricular points, skull points and nose points and other sujo points, bial meridian points, horizontal points and vertical line points. All these things points, I hope so, more than 1000 it goes. See, Dr. Sridhar has been made, there are around 10 points has been activated in one finger. Right, I believe. One finger there are many points. Even Professor Park Jau, even we salute to him, we thankful to him, and God will give peace in the heaven, and he is no more. And I am a student of Professor Park Jau, and who initiated and written lot of books, and worldwide in the universe, Su Jok is the Korean philosopher, has been written lot of books in terms of Sujok acupuncture or Sujok acupressure, and he also invented lot of points in the palms and sole of the foot. But how has been invented? By looking the body virginal point. 2000 around 500 years ago, before the Christ, he has been originated points. There are the 361 points has been originated. By looking those points, by seeing those points, Professor Park Jau has been brought to the palms and soles. Those meridians is known as the micro meridians. That also known as the bial meridians. By placing that, and many people has been invented, Dr. Mehta from the Allahabad, so he has been invented, that is that is vertical meridians, horizontal meridians, etc. So however, what are those, and we have dilemma, so which point we need to activate? In the same place you want to activate lungs, in the same place there is a other organ also situated. Then how can we manipulate? That is when I will talk about the conclusion, I would like to tell you how to treat all these things. But here, only the few points, around I can say, 50 to 60 points, even among the 361, 100 are most important. You come down, 60 is most important. You come down, 30 is the very most important. You come down again, it is 20 is the most important. You come down further, there are only the 16 points are important. Further you come down, there are only the 8 points are important, which you can treat for all the diseases. There is 1000 points, we are coming under only the 8 points. Now it is beyond the limit. No doctor, I cannot imagine this, how can be possible? Since there are the 3000 diseases are existing today, and today further they are doing the R&D people, is every day there are the new diseases, but there is no remedy for that. But we have no diseases names, but we have remedy for everything. We have short-term courses, but we have long-term answers to treat for all the diseases. Huang Di says that, and Chi Po says that. So any disease cannot cure by acupuncture. But I don't think so, but it is possible to cure for all the diseases. But again it is left to Almighty. Right. Further, I would like to highlight here another concept about the diseases. I think so you take the short break, further we can start this concept, and you need some refreshment. Please stand up for some time and sit for stand for some time. And a few minutes, then have a seat, do the relaxation, further we will start with